sure I'm probably wearing the same outfit.
The exact same things last time.
I'm wearing the other.
Thanks, guys.
I can't. Okay. Alright, so tonight I'm going to be talking to you guys about spinal stenosis and the treatments of it. This is actually an increasing health issue for a lot of Americans. It's not life-threatening, but it is threatening to the quality of life. One day, this very well could affect someone you know in your family or yourself. It's a degenerative disease, and you can't really predict who it's going to affect necessarily. The reason I chose this topic is because my dad was diagnosed about a little over a year ago with spinal stenosis in his lumbar region. So I know the treatments, I've been to appointments, so I kind of know how it goes, and I was really interested to find out more about it. So first up, what is spinal stenosis? It's actually a narrowing of your spinal column, which reduces the space around your spinal cord and your spinal nerves, which causes pressure in your spinal column. It can happen in any region of your spinal cord, the cervical, thoracic, or lumbar. This shows the lumbar region over here, which is the lower part of your spine. My dad actually had 80% of his L3 affected, all of his L4, and 20% of his L5. So just some facts about spinal stenosis is it affects over 400,000 Americans every year, and almost 20% of those cases are severe, which requires surgery. The reason this is an increasing issue is because the baby boomers make up a really good portion of our population right now, and they're all aging, and they're starting to fall into the 60 to 69 age range, which is what they found to be the prominent age range for when this becomes evident in people. And as I said before, it's affecting their quality of life. It makes walking, standing very difficult, just daily activities that they do. And what we're going to be talking about is how you identify spinal stenosis, the treatments, which are physical therapy, epidural shots, and surgery. So, ways to identify it. The signs and symptoms that you're going to see in people are going to be radiating pain down their lower extremities, back pain. You're going to have a burning sensation, possibly numbness, weakness, tingling. These are some pictures to show you. This is the radiating pain down the legs. It's going to start from the pressure that's in the back, and then you have pain on the outside of your legs usually. And then a lot of people on their daily activities, they have a tendency to rest on things and try and relieve that pain. And the best way to do that is also to sit, so they actually become really immobile. Next up, you're going to collect medical history on them, and they then will follow it up by a physical exam and different questionnaires. The first questionnaire will be the PSQ, which is Pain Sensitivity Questionnaire, and then the ODI is the Oswestry Disability Index, and the VAS is going to be your Visible Analog Pain Scale. And then lastly, you're going to get an MRI, which is going to give you a three-dimensional picture of what's going on in the spinal cord and show that inflammation and the pressure that's being caused. Unfortunately, MRIs aren't always available to everyone, or they can't have one for some reason. So a CT is the next best thing, but MRI is definitely the first choice. So we're going to talk about physical therapy. This is usually prescribed to people who have mild or moderate conditions of spinal stenosis. And what you want to do is, their main focus is going to be building your strength and your endurance. And then they're going to work on your flexibility and stability, and then increasing your balance. All of these things are affected every day by people who have spinal stenosis. So what they're working on here mostly is like her core muscles and her back muscles, and then the leg muscles, and trying to build all these things up to help prevent that pain. And obviously their ultimate goal, according to the Mayo Clinic, is to relieve the pain that's being caused by the pressure. Next up, we're going to talk about epidural shots. These are steroid shots, and they are injected in the spot where the inflammation is thought to occur. Epidural shots are given on the belief that pain is caused by inflammation. So if you have inflammation, it's going to be relieved by an epidural. But if you don't have inflammation, then that's going to be a key thing, and then finding that maybe it's not spinal stenosis. So then this is also not effective for everyone. It affects anyone and everyone so differently. It can be a very short-term thing, or you can have a really good take to it. It can last a few days, a few weeks, or a few months. You just never know. And then this shows a picture of where it's injected and kind of how it works. They stick a needle in your back, which is really uncomfortable. And then if this is a short-term fix for you, then they may repeat it, but it can only be repeated a few times a year, and it can only be repeated every few months. And last, we're going to talk about surgeries. My dad actually had this top surgery, which is a laminotomy. That's a tongue twister. This is when a portion of the lamina is actually carved out, and so that pressure can be released in that specific spot. So what they do is carve out a piece right here, and so that pressure can be released from the spinal cord. Then they have a laminotomy, which happens when they remove the whole back part of your vertebrae. And if this is the case, then they're going to have to use hardware to create support. So you're going to have medical grade screws and metal put in your back, because obviously if multiple vertebrae are affected, you're going to need to build that stability for when you want to move and turn and things. A laminoplasty is going to be when they take the lamina and it creates like a hinge-like movement. So every time that pressure builds up, it's able to expand and the pressure can be released. Again, that's going to require some hardware. So this is probably the one that you want to pick. And then these are all forms of decompression. And according to an article by Costandi, it's the standard of care for spinal stenosis. So in conclusion, you really want to have an early diagnosis of spinal stenosis, which can be hard sometimes, because then you can have physical therapy and hopefully you can postpone the need for surgery, since there are a lot of risks when you have surgery and you never know how it's going to turn out or if the effects are going to come back. So physical therapy is going to be your least invasive option that you want to get. And then your epidural shot is going to be the most cost effective, since it can last a varying amount of times. If you only have to have it maybe once a year, that's great. Or even a few times a year, it's still a lot less expensive than surgery. And then obviously surgery is going to have your most risk. It's going to cost a lot, and you know, if you have severe spinal stenosis, unfortunately that is the last option that you have to choose. So, and these are all my references where I collected all my information from that you guys saw and heard. And then, does anyone have any questions?
Ouch.
Right.
Thanks, guys.
We all should play musical chairs.
Right. I would pause it.